Welcome to the Healthusiasm podcast, a panel discussion on trends and innovations in health and self-care. My name is Christophe Choquet. I'm the author of the Healthusiasm books and a professional keynote speaker on health, business, and technology. Every week, I discuss with a panel of experts the positive changes that are shaping our health and happiness. And for this discussion, we have two of your beloved experts in the panel. We have, calling in from Barcelona, our digital health connector, of course, Aline Noizet.
Hola.
From Ghent, Belgium, human experience expert Mo Zouina.
Hello.
This means that we are missing our, from Scotland, our medical expert in digital innovation, Dr. Keith Grimes. He's at the Radical Health Festival in Finland. And in that case, we always invite a special guest to our panel, some new blood, some other expertise. And our guest today is somebody I've met in a previous part of my career, when we were working together on several patient experience projects. Basically, what she does is she helps businesses drive insight-led patient engagement and advocacy. In other words, it's somebody you can easily call a patient expert. She worked as a global patient engagement and innovation expert, even at a global level for companies like Amgen, Reckitt, and Unilever. But most of all, she is a super nice person that I love to have a chat with. So I'm very happy to have her on the show. Welcome, Natalie Bloomfield.
Hello, Christophe. Thank you so much. What a nice introduction.
It's nice to have you on. It's nice to have this discussion with you guys. Are we feeling it today?
Very good.
Absolutely.
Mm-hmm. Lovely, because in this week's episode, we will be discussing the Healthusiasms of the month of May. Some positive changes that we have seen in the past weeks and that we would like to share with you, our listeners. So without further ado, tell me more. What Healthusiasm did you witness in the past months?
Well, Christophe, this Healthusiasm is right up my alley, not just the topic, but also the affinity I have with the topic. You know, just like Dr. House is known for the sentence, everybody lies, I will probably go down in history with the sentence, everybody's lazy. Or let me rephrase that, life is lazy. Or let me rephrase that again, life does not like to waste energy. And when I talk about life, I talk about some incredibly lucky mice. Yes, lab mice. In recent studies conducted at research centers across the United States, there were mice that were able to chow down, fatten up, and exercise only when they felt it, and still they managed to lose body fat, improve blood lipids, increase muscle power, avoid blood sugar problems, and boost heart function. Now, why did these mice get so lucky? They were giving Mimetics, experimental drugs that mimic the effects of exercise and calorie reduction in the body without the need to break a sweat or eat less. There was an exercise mimetics called SLU-PP332. It's like a number plate. And it made mice look like marathon runners without any form of exercise. And on the calorie restriction front, there was the manoheptulose, which is called MH for friends. And it's a sugar that's found in unripe avocados that stopped the nasty effect of a high-fat diet in mice. And it increased their insulin sensitivity, which is good. And that was studied by Dr. Donald Ingram at the Louisiana State University. And I think this could become the next frontier after the GLP-1 drugs for weight loss, because we all know GLP-1s have downsides. One of them is muscle mass decrease. This gradually changes our metabolism. And as you lose weight, you also lose muscle mass, and you also lose your calorie burning abilities, with a potential incredible yo-yo effect should you stop the GLP-1s. Okay, so these mimetics could potentially address this issue by preserving muscle mass and supporting metabolism. I see a great future for elderly people, for instance, who lose their appetite, muscle mass, and vitality as they grow older. But, this is, I think, the first drugs that could have us have our cake and eat it too. It's not just about weight loss. It's a drug that also can help us extend the health span, keeping us healthier and younger for longer. So until these wonder drugs hit the market, unfortunately, we might still have to rely on good old exercise and diet. But who knows? The future might just bring us a pill to pop more.
Nicely put. Can I say you were a little bit lazy in finding the Healthusiasms?
Yes, you can. Because
I
think you're right.
Because I think one of the unusual ones that we touched upon in episode 15, which is already quite some months ago, was about exercise mimetics. It was about obese mice, but it's a different study. I've just looked it up real quick, but just playing on the laziness part, it's something that we already discussed at some point in the podcast. Indeed,
You're absolutely right, but the mind goes where it wants to go.
Let's stick with the laziness part. And you mentioned the GLP-1. I'll stick with weight loss business in that regard, because Nestlé, which is one of the world's largest food and beverage companies, said that it is planning to launch a frozen food brand. And what's specific about the frozen food brand is that it will cater to consumers who use GLP-1 drugs. Because if you use these drugs, you might be in need of certain nutrients to remain and to stay healthy in the course of your journey with GLP-1. And so you particularly need more protein, more calcium, more iron. And so they will bring to the market a product line, which is called Vital Pursuit. And it will have about 12 items, products, let's say, that will be in the frozen foods department in grocery stores. And it includes things like protein-based pasta, sandwiches, pizza, whole grain-filled frozen balls. Not entirely sure what that is. But yeah, it will be available specifically for that are using, or those people that are using GLP-1 treatments. Thing is that it will not have a GLP-1 medication label on it, so you will have to look for it, apparently. So in that regard, you won't be needing to be lazy, because otherwise you won't be finding it anyway. But some interesting things happening in a couple of spaces where a lot of people are. I mean, a lot of people want to have these GLP-1 medications. A lot of people are lazy indeed. But let's go to a more specific area, a more rare area, and let's go to rare diseases. Natalie, you had something on rare diseases, I believe.
Yes, I do, Christoph. So really happy to share. Last week, I joined a conference. It's known as the ECRD, which stands for European Conference for Rare Diseases. It happens every 2 years. And this time it was held in Brussels. And it was attended by like over 700 or so people. And I left with a really refreshing and sort of energized spirit to the rare disease conference, because I was not so exposed to rare disease conference prior to that. But here in this community, over 50% of them were actually patient advocates, and some of them researchers, policy health makers, and they are really a tight-knit community. And what I like about them is it's a patient community in rare diseases, is that there's so much collaboration, creative collaboration. They pull together their resources. They have a lot of difficulties and remarkable similarities in terms of the challenges they face in the healthcare. And to be efficient, right? We don't want to keep reinventing the wheels. They have these conferences that share their experiences. And, when I think about your book, Chris, about your transformational economy, I just don't think it can happen without people like patient advocates. They are the ones breathing, living it day to day, and they just don't get enough recognition for what they do. Really underrepresented. And, you mentioned earlier about rare. It's actually not as rare as we thought. And this is also new news to me, because rare diseases, there are about now known 7,000 rare diseases. And it affects about 1 in 12 people in Europe. 1 in 12. And, globally, I think there was a stat that showed that there are 350 million patients living with rare diseases, and 80% of them are genetic disorders. And in fact, about 50% of them are children. So these are chronic conditions and they have, complex needs in terms of healthcare. So they face a lot of challenges like delayed diagnosis. And I came across some statistics, which was really eye-opening for me as well. I'll read a couple of some of them here. The first one, the average rare disease patient waits 4 years before they receive their final diagnosis. And they would have cycled through 5 doctors and received 3 misdiagnoses. 1/3 of them do not have access to the medicine they need. And many of them wait several years just to get access to the right medication. And when you think about that, I mean, it paints a picture, right? Like, the frustration they must have felt going through the misdiagnosis, also the trust or the mistrust they have towards the healthcare system, potentially. Yeah, so I just find it remarkable. Many of them, they're not academics, but they have to learn the languages of science, of medicine, and and to represent the broader patient community. So it's really tough work. Yeah. So yeah, I really take my hats off. But also these are sort of some of the main observations that I've come across. Yeah.
Yeah, what lovely. And I think in many ways, the rare disease areas or the communities that you're talking about, I think they could be very inspirational for the entire healthcare ecosystem. You mentioned the tight communities. You mentioned the mistrust. I mean, it's not only in the rare diseases; it's more elaborate, maybe in or more present, maybe in the rare diseases communities towards the healthcare system. But I think it's pretty much everywhere, and I think it will. I think it risks to grow even bigger in the non-rare diseases. I think we had a conversation in the past, you and me, about how healthcare will evolve and how, with personalized medicine and so forth, n is equals one. Basically, you could state in a way that many of the diseases will become, I wouldn't say rare, but unique diseases, because we have better profiling of the diseases, we have better profiling of the patients, we have better profiling of the treatments. So in many ways, the future of healthcare could be considered or should be treated as in the same way as we now approach rare diseases, with this tight communities, with people who are maybe non-medical professionals who need to go into that healthcare space and learn about a lot of things happening. So I think it's very, very inspirational. It's a lovely Healthusiasm that actually the whole healthcare ecosystem should be thinking about. Mo, you wanted to jump in here?
Not at all.
Okay.
But I was just listening. It's true. I think what you say is that since everyone will be profiled as much, it just hit me when you said it. And it's about personalization. So it's also about human connection. I think what it's about. The question is, will we have the resources, time, and attention to service it like that? And I think there's a need, one, and the second is, are we equipped? And we'll loop back to that later. I think willing is one, able is two.
Yeah. And that brings me to my next Healthusiasm is about female doctors, because willing and able, I think female doctors can actually be very willing and very able to bring that personal connection and to do that, to have that relationship with patients. Because in one study that was conducted by the University of Tokyo, but they used data from the States, 1,000 Medicare patients that are aged beyond 65 plus. They analyzed how those patients experienced the healthcare system when they were treated by female doctors. And it's a peer-reviewed research, so it's decent. And what the research said, the key finding of the research was basically that patients treated by female physicians had actually lower mortality and lower readmission rates. They really had a lot of better outcomes when they were treated by female physicians. And that was even more the case for female patients. And one of the reasons is exactly that thing that you said, Mo, is that we need to have that connection, that ability, that willingness, and female doctors are likely to excel in those regards. They have a better patient-centered care and a better communication skills that maybe their male colleagues have. But again, willing, able, so far the good news, because what we've also seen, and this is a Harvard Business Review for 2022, is that more women physicians are quitting their job. Mainly because they face burnout, mainly because they have perhaps some lingering depression that is due to the demanding workloads and the fact that they approach things more intensively right now. They also feel less supported, the female doctors. They feel less aligned with organizational values, which are primarily put forward by male managers, let's put it that way. And they have pay gaps. They're excluded from leadership and so forth. So women doctors who are able and willing to do so are quitting or reducing their hours of working, which doesn't help with the healthcare staffing crisis that we already have, but which doesn't also help to build that connection that you just mentioned. And that is necessary even in many diseases and definitely in rare diseases.
I think it's something that has an upside and a downside. I think the threshold in which self-care is initiated with women is lower. We see that. And I think that if the workload becomes higher, the self-care reflex is also faster. So I think they're less willing to go over their boundaries just despite their own care. So it's the advantage we have of having women caregivers in the industry is also protecting themselves to live an unhealthy life. So, but I think women working in community and in a team, I see it in the clinic where we have 0 men in the clinic working, and it's very supportive. It's an incredibly supportive team. And they wanted to hire a man. And I said, let's wait a little bit, So, yeah.
Okay.
Pros and cons.
Pros and cons. Female doctors created a lot of connection, as we mentioned. Pros and cons could be also about the conversational agents, because they can help, but they might have some challenges as well along with it. Mo?
Yeah, might be a reason why most of conversational agents are female voices too. Right.
True.
Conversational agents such as Alexa and Siri, they are designed to answer questions, they offer suggestions, and even display empathy. Yeah. But there's also new research that finds that conversational agents, and not women, do poorly compared to humans when interpreting and exploring a user's experience and really into diving deeper. And these conversational agents, they're powered by large language models, as we all know, that ingest massive amounts of human-produced data, and by default is flawed. And they can be prone to the same biases as the humans from which the information comes. So there is no program or code to integrate inclusiveness and ethics in that, because researchers from Cornell University, all in college, and Stanford University tested this theory by prompting conversational agents to show empathy while conversing with or about 65 distinct human identities. And they found that conversational agents make value judgments about certain identities, such as gay and Muslim. So they take shortcuts, just as humans do. And these conversational agents can also be encouraging of identities related to harmful ideologies like Nazism. And despite the fact that these large language models received high marks for emotional reactions, they scored low for interpretation and exploration. So they're able to respond to a query based on their training, but unable to dig deeper and find the nuances that are linked when interacting with someone who is prone to certain biases. So my interpretation is, since voice technology delivers this in a very empathic voice, we might be tricked into just mindlessly accepting whatever content is delivered to us and make us even more gullible than we are today. Because we go back to trust, if you trust a voice, you might make a shortcut that you trust the content. So by delivering it in a very nice experience and a very empathic experience, we are less critical of the content that is displayed to us. And I think that is also a way forward to balance both, delivering it in a nice way, but also making sure that the content in itself. There's a French saying, as we all know, le fond et la forme, as they say. So the way it's delivered often dominates the content that is really delivered.
Yeah, it's a very valuable point. And I remember a quote saying by Sam Altman, the CEO of OpenAI, who said that we're always talking about artificial general intelligence, which is the level of artificial intelligence that will surpass humans and that will dominate humans. But what he said at a certain point was, we don't need AGI for AI to be dangerous, because AI can be very convincing, and even, push forward ideologies or what have you all onto people. And that might be pretty dangerous. And I'm actually dealing with this right now because my son, who's 11, he asked me to download character.ai. I don't know if you know it, but it's an AI where you can talk with fictional figures. So mostly from anime or manga or those kind of, and he really wanted to do it. And I said, I first need to talk to you about these kind of things, because there's some things you need to know. And then he just went to ChatGPT and created his own character and does the same thing right now. So I'm really in a situation where I need to, because he does it every day, and I noticed that he's on ChatGPT and talking to those own created characters, and it's really important for people to understand where this could go to and what the dangers are, of course. I'll stick with conversational agents, and I mean, we have to bring it up. ChatGPT 4.0 right? It's all over the news. You were talking about, what did you say? The female empathic voice. There was a whole saga around whether or not Scarlett Johansson did approve a similar voice, so that ChatGPT sounds a bit like her. But they did a big announcement. Well, big in a sense that it's the first language model that is as multimodal as that, which means that it can handle text, it can handle audio, and it can handle image simultaneously. And it replies with a speed of 320 milliseconds, which is similar to human conversation, basically. So it's pretty impressive. It can give you explanation. It could translate stuff, and not in a way that as Google does, but it will tell you as a third person, and it will translate it to you and talk to you as a third person. It could even tutor. That's something I'm really looking forward to, because I'm done of tutoring my 11-year-old son, to be honest. So I'm very keen on seeing this coming out. And obviously the medical applications are super obvious. Those kind of large language models, definitely if they're multimodal, they can serve as an interface to command softwares, to command hardwares, whatsoever. It could help explain medical results. It could help, set up action plans, even guide you or coach you along the way. So we are getting towards that, personal assistant, as in the movie Her, as was referred to by Sam Altman, by OpenAI himself as well. So this, human-computer relationship, as you were mentioning, Mo, is coming real close. But the biggest news to me was that what OpenAI did here was they actually opened it up. So it's less expensive. So it's free for more people, which means that ChatGPT could be used by more people more easily now. And I have to say, I was talking about my son, how he uses ChatGPT every day, my 11-year-old. I use it also every day. So it's amazing how such new technology is really integrated in my life so easily. So I'm very curious to see how this new form of multimodal large language models will become personal assistants really, really quickly, how they will integrate into my life. So that is something I'm really keen seeing, definitely because of the fact that OpenAI wants to take the market as the Amazon model. Basically, you do it for free, everybody can take it, and will take the market as quickly as possible. Talking about integrating in daily operations or daily life, maybe interesting as well. This past week was the announcement of Sanofi, who announced the deal with OpenAI. They want to, together with OpenAI, they want to accelerate the development of drugs. They also want to accelerate the new application of existing drugs. We talked about that offline as well, Mo, right? How you can repurpose existing drugs for other types of diseases or whatsoever, but also matching drugs with patients, because you have specific patient profiles based on genomics. You could even match drugs better to certain patients. And what they say is that this deal has the ambition to totally reimagine drug development. That's what they say. And Sanofi has been on this ambition for a while, because they have partnerships with other AI companies. Like, I'll just list them here just to show how much they are into this field. A company called Okin, a company called Exsentia, in silico medicine, of course, Munich Pharmaceuticals, Atomwise, Agemia. So all companies that are in the field of AI to accelerate the discovery of drugs. And they're not alone. Also, Moderna has intensified their collaboration with Open. Because definitely for Moderna, it really seems interesting as well, because Moderna is very much focused on the mRNA, which obviously has a lot of information that needs to be analyzed. And they want to use that information from mRNA to indeed speed up the development of the right drugs, predict the structures of mRNA and so forth, and use it for specific purposes. But they even want to go further, not just the drug delivery. They want to go into research, manufacturing, and the whole commercialization of drugs. So talking about conversational agents, talking about Gen AI, if you haven't integrated yet into your operations in some sort, now is the time, because things go real quick. Did you see any other Gen AI related things, Aline, in recent weeks?
Yes, I saw a lot, because I went to different conferences, and I also reviewed quite some startup pitches. And I was quite amazed to see how many of those startups actually working on Gen AI solution for pharma specifically. So all what you mentioned, like clinical trials was a big thing in those decks, but like different sides of clinical trials that found that what was interesting. So like in silico solutions, when you can actually use like computer models to develop those drugs before doing them in vivo, platform to recruit patients, platform to find clinical trials. So different sides of that platform, and also solution to help accelerate the regulation of dossier. And I think that's also very important, right? More the admin part. And there was also some interesting solution for like marketing side. For instance, there was a team, like some students that I met a few months ago, like master students, and their end of year project was actually to work on a Gen AI solution for pharma companies. So to create like medical and promotional content to streamline the content. And they decided to continue with that project. And they presented it at, so my friend Shwengi, he started a series of events called Gen AI for Pharma, number 4. And he's been doing some events already, and you can go on his website and you can see the different startups that actually presented at the event. So it's a really like growing space.
Yeah, I love it. And indeed, it just goes so quick. It's hard to understand where this is going, how fast it goes, and what it could offer. I've been asked a couple of times by different companies to explain them how they should be using it. Pharma companies mainly. How can we use it in our daily operations? We all have professional accounts, but we're not really quite sure how to actually use it, and it's really valuable.
Natalie, you had a remark.
Yeah, no, just as a comment to add on to what Aline was saying, right? In terms of generative AI for pharma marketing, it's also something that I've come across quite a lot in the last year or so. Just targeting, because one of the gap on the HCP side is information fatigue. So pharma companies need to be much more strategic how they do the messaging. And it's about delivering the right content at the right time. I mean, things we have been doing in FMCG for a while now, but there is a science to this madness in a way, right? So to provide engaging content, and generative AI seems to be filling a gap there. Lots of companies working on that. Yeah.
Yeah. And you even have these certain pharma companies that are making their own generative AI or conversational agent. I've heard Pfizer had developed something called Charlie, which would help the entire organization with digital media, emails, digital presentations, and anything that could help to personalize, as you say, Natalie, conversation that they want to have with the different medical stakeholders. And I mean, Pfizer is always one of the early movers in that space, but I think it will only radically increase, and hopefully it will help to build better communications and to build better information tailored to the right person, not only physicians, but definitely also patients. Because we were talking about NS1 and the rare disease field and how we have personalized medicine and so forth, but we also need to have personalized communication and personalized information. And I think we're on the verge of something incredible here that we don't even realize how big and how amazing it could be if done right, of course.
I just want to add something. As you know, Aline, I'm involved also in a medical education app, which is called livelinkslearning.com. And Natalie, as you were saying, getting access to expert opinion on how to treat a patient is very, very scarce. And delivering it in a way, so we saw pharma shifting from commercial to medical education as the new promotional channel, with MSLs and things like that. But the problem is these experts are not available to talk to everyone. So everyone would like to have the best expert giving them the best advice. And we're not looking at a solution how we can scale the expertise of these best experts and deliver them in an experience that feels personalized to the scale of one, right? So that you could be coached through a patient case by a world-renowned expert. And there are some challenges with which we might talk about offline, but it's really interesting that attention and expertise are kind of the new resources in HEP engagement, right? And delivering that in an experience that feels engaging to the human brain. So that is something we're also working about. And we addressed Gen AI in that. And there's a lot of inertia on that, So if you have ideas, I'm very open to that.
I mean, that triggered a thought about something I heard in a webinar a couple of weeks ago that I'm not sure how prevalent this is, but apparently some pharmaceutical companies, they are in an attempt to break down silos, right? They are creating team agnostic or brand agnostic basically, there is a blend between medical and commercial. Obviously, there are some compliance issues there, but they're trying to find a way to like a person that can talk about these things holistically, because, now HCPs want more medical information, not just product information. So I think that sounds for me quite intriguing. Not quite the same thing you're talking about, but somewhat related, right? In terms of
absolutely, it's kind of unbiased, unpromotional, and it's just about upping a physician's therapeutical decisional game, right? And that's what it's about. So we might do a different topic about that, but I think we still have one Healthusiasm pending, and I think it's Aline's, right?
Aline, the last Healthusiasm is for you.
Yes, I read the news that I found interesting because we are not getting any younger. And I think that solution could potentially be useful for us in a few years. So a team of researchers from India Institute of Technology have been working on a new technology that could revolutionize knee injuries. So it's a cutting edge 3D printing technology with a silk-based bio-ink focused on the meniscus. So the meniscus is often difficult to treat surgically and can be very painful. Like we may have example in our family or maybe even ourselves. Traditional operations can come with complications post-surgery. They're not always successful and they may require lots of rehabilitation afterwards. So what the team has been doing is they're using 3D printing to create a tailor-made bio-ink specifically for tissue engineering of the knee meniscus. So the ink is made of different materials and is inspired by the Indian tradition of silk clothing.
Oh.
So far, they did lots of animal testing to ensure that the bio-ink would stand the stress of load and movements, and the results have been very successful. So they demonstrated resistance to stress and that it did not trigger any negative immune reaction, which will enable them to move to patients soon. So good news for us. So the idea really by using 3D printing, those team of researchers want to offer patients a less invasive solution that can promote tissue healing while preserving the knee function.
I'm very interested. I'm a former basketball player. I used to play a lot of basketball. I was never a professional, but almost just not professional, let's put it that way. And my knees are completely done for. I mean, I'm waiting to have a knee replacement. I'm doing all sorts of other stuff to avoid a knee replacement at my age. But yeah, every innovation in the knee area, just bring them onto these Healthusiasms.
Perfect.
Two things. Christophe, come and see us at Relief. And secondly, Aline, I think it's the sexiest way I've heard someone pronounce meniscus. The meniscus. Very good. Very good.
Gotta love it. Okay, to close this podcast, I, per usual, have a couple of unusual ones, of course. And for each one of you, I have one. Let's start with Natalie. Here we go. What are CoolCations? It's a new trend. CoolCations.
CoolCations. Are they like cool locations? I don't know.
No.
CoolCations. I'm drawing blanks here.
Okay. More? I saw you nodding or thinking.
I don't know. Could they be named icecations too?
Some it could go in that direction, yeah.
Is it a holiday where you do cold therapy?
Of some sort. It comes down to the fact that, climate change is heating the planet. And what we see is that travelers are choosing mountains over beaches, Northern Europe over the Mediterranean Sea. And it was coined by the Future Laboratory, which is a trend agency, as chasing the shades. So places like Scandinavia, the Baltic, Slovenia, Poland, and even Belgium are supposedly emerging as alternative destinations. And so what people are looking for is adaptation to the environment. And things like climatotherapy will become essential in traveling. Climatotherapy is actually the effects of different climates, or at least the effect of different climates on your body, and how you should predict the health changes that it could induce. And then you also need to, adapt your body or do some other things like thalassotherapy, hydrotherapy, or cold therapy, as you were saying, Mo. CoolCations, the trend of no longer going to the south, but going maybe even to Switzerland, Natalie. Maybe you might see that as well.
It's warming up here as well. But Chris, I'm so bummed that I didn't get that right, because I go after the shades, people who know me, because I was born and raised in a very tropical country, right, in Singapore. So I am always looking for shades. I'm so bummed. You got that in staycation. Now I
Well,
get
it's not a new trend for you then. So that's maybe why you missed out of it on it.
I very aligned with that. That's where I've been doing my vacation those past years.
Yeah, but you live in Barcelona. I mean, that's not fair.
Yeah, it's getting too hot here.
Yeah, I can imagine. I'll stay with you, Aline. Listen to this. I have a small story that I'd like to share with you. Once a week, Sun Kai has a video call with his mother. He opens up about work, the pressures he faces as a middle-aged man, and thoughts that he doesn't even discuss with his wife. His mother will occasionally make a comment, like telling him to take care of himself, but mostly she listens. What is so special about this call?
I would think that the mother is not alive anymore, and it's like an avatar.
It's correct. So Sun's mother died 5 years ago, and the person that he is talking to isn't actually a real person, of course. It's a digital replica made of her, a moving image that can conduct just some basic conversations. It's made by a company, Silicon Intelligence, from China, which Sun Kai co-founded in 2017 already. Obviously, legal and ethical implications here are a little bit blurry. Let's put it kindly here, but it's really, it's an AI to interact with lost loved ones, if you will, so that it can help ourselves to mourn or to heal from a certain loss. It's called the digital immortality economy.
But she can talk, right? Because you
She
said
can
that
talk,
she listens, yeah.
Well, it started in 2017, so the earlier versions it was very limited. But again, as we said earlier, with the conversational agents and Gen AI, they are integrating it as well. And definitely now with the voices that we've heard through ChatGPT, it will probably rapidly increase. And it's made simply based on a couple of images and a couple of videos that were created. It doesn't look so real yet. But this digital immortality economy, AI cloning of the dead, it's something that we might hear about a little bit more in the next couple of years for sure.
But I'm not sure if it really helps with mourning, though.
I agree. Maybe.
Well,
I don't know.
Well, as long as you're not living it, you don't know, right? I think that's something that you have to have experience to know exactly how it can relieve. I remember 7 or 8 years ago, there was a video online of a Korean company, and they virtualized a child that died, when it was about 6 or 7 years old. And they gave the mother a virtual reality mask and also gloves that she was able to hug her child again virtually.
Oh, yeah, I've seen that. Yeah.
It was heartbreaking. So I think for bystanders, it's very hard to know how that can soothe or not soothe. I think that's for the person who's living it to decide.
Yeah, and I think was it Kanye West when he was still together with one of the Kardashians, who
he's not had them all. He's just had a one.
I can't remember. I mean, I'm not. I don't really know them, but I remember that he gave her for her, I don't know how many birthday, a hologram of her father who deceased a couple of years before. So her father came with a message and a hologram version in front of her. It was all over the news, very viral. Whatsoever. Typical Kanye West style. Let me see. Mo, still have one for you. Max Hodak, ex-CEO of Neuralink, left the company in 2022. Heard of him?
I have now.
Okay. So he's back now with another company that does brain-computer interfaces. And the company is called Science Corp. It's the startup in that field that is the second highest company funded. So I think they have about 140 million euros in funding. And what I'm asking you about is, what is the solution that he brings? The company is called Science Eye. And what could their ambition be? It's a computer brain interface company called Science Eye.
I think your pupils have a certain emotional response. Maybe the pupils and the eye are the gate of a kind of a communication, because I think the the brain-computer interface is kind of invasive, and maybe it will use the eye as the new interface. Maybe, I don't know.
It is the eye as a new interface. Anybody heard of it? Anybody want to complete it? So basically, as with Neuralink, they want to, people that are paralyzed, they want to give some means again in life. Here it is a clinical visual prosthesis. So what they will make is basically a new treatment for blindness, if you will. They will combine gene therapy with micro LED displays over the retina. And in that regard, they will restore the vision in blind people. Or it's implanted it in several bunnies, and it apparently works rather well. But the most amazing thing, obviously, I mean, if you have a micro LED display over the retina, where are we going with this? We are going into a whole new interface for augmented reality or virtual reality display technology, of course, which is quite amazing because they say that it does not require a meaningful or an intensive surgery. So they're testing it on bunnies, mainly blind bunnies, but the end goal is really to get rid of these chunky devices that we now know as Vision Pro and Oculus and what have you all. So very interesting evolutions, if you ask me. So that's it. Thank you all for your Healthusiasms. And yep, it is a Healthusiasm world indeed. Many positive changes are making our world a little healthier and happier every day. But now it's time to wrap up the Healthusiasm podcast for this week, of course. Thank you for listening. If you like the show, don't forget to hit the subscribe button on your favorite do that again, eh? If you like this show, don't forget to hit the subscribe button on your favorite podcast platform or go to healthusiasm.com. For now, I'd like to thank our panelists for their Healthusiasm. Thank you, Aline Loiset, Mo Zouina, and Natalie Bloomfield. My name is Christophe Choquet. We are the Healthusiasm panel, and we'd love to see you again next week for some more Healthusiasm. Ciao.